Well, as President Obama's nominee to be the country's new health czar calls for more openness with everyone's medical records, we are getting new information on an explosion of what is called medical ID theft. Last year, there were more than 275,000 cases of medical information theft in the United States. The average cost of such fraud is over $12,000 to a person. By comparison, the average cost for all identity crime last year was less than half of that, around $4,800. So once even more medical records are stored in electronic form, could fraud cases skyrocket? Joining me now is Louis Sacoccio, Executive Director of the National Healthcare Anti-Fraud Association. Louis, thanks so much for being here. All right, so
thank you for inviting me.
How the medical records going online was something that came after the stimulus bill. I mean, that wasn't really a healthcare reform item. It was the stimulus bill that said, let's include a couple of $1 billion to help people's medical records go online. And there was a bunch of controversy about it then. But now that healthcare reform is law, you have a fear that medical fraud is going to go up. Why?
Well, medical fraud has been a problem for a long time, and certainly with the advent of electronic health records and electronic claims in healthcare, it's a problem that's going to increase. But obviously, you can't move away totally from electronic formats, either for claims or health records. That's the wave of the future, and it's going to be here. So what we have to do is ensure that the systems that are in place, the electronic health records that are used, the systems that are used, are designed in such a way that they have the type of security that's required. Just like on the financial side, when you talk about credit cards, online banking, those kinds of things, you have to have the same concerns, the same protections on the healthcare side as you do on the financial side. As this all goes forward. How is it going
to happen? How would the average person be defrauded with their electronic medical records?
Well, it happens in several ways. First of all, there's organized crime groups, for example, that get access to folks' information on the inside, either through paying for it, it's stolen, and folks on the inside of healthcare entities or healthcare providers that want to make some money can actually steal this information and sell it on the outside, and then that information is used to submit fraudulent claims. That's happened in the past. It's still happening. It happens on a large-scale basis. And it's something that the federal government has to put a lot of focus on and is focusing on to a certain extent. The other way it's done is that individual A takes the identity of individual B in order to get actual medical care that they perhaps can't afford, and that's a common practice as well.
And is there any risk of people just being nosy? You know, they want to find out, maybe you work in a hospital and somebody you know comes into the hospital and you're just kind of curious about what are they in there for?
Sure, that's happened before, especially with celebrities, people that are in the news, where somebody that works at a hospital wants to know what the deal is and what the illness maybe is, and then maybe sell that information on the outside to the media. So that's a concern as well. But the real big concern, I think, is stealing folks' identities, getting information into medical records that doesn't belong to that particular individual. That could hurt that individual down the road. You know, if somebody's using your identity to receive treatments for illnesses that you don't have or conditions that you don't have, and then down the road when you go to get treatment, you find out that information's in your medical record, that could be obviously of great concern to you and also could do harm to you, for example, with respect to allergies to different medications, those kinds of things.
Now, you know, when you mentioned comparing it to the security we go through for online purchases and online transactions. I mean, now you can, if you go to a website, you want to buy something, sometimes you get up the little box that says, do you want to use PayPal? Or you get up the little box that says, this is a secure transaction, no one's going to be able to find your credit card information. Is there anything similar to protect us when it comes to our medical electronic records?
Some of the health plans, some of the private health plans do have things in place with respect to their websites and getting access to those websites and exchanging information with your insurance carriers. Physicians' offices are starting to come up to speed. Some of the providers, the healthcare providers, depending on their size and their financial ability.
All right, but we're running out of time. So what you're saying is it's spotty. So what should the average American who's concerned about this do?
First of all, they should be very careful they should treat their medical information and medical insurance information, whether it be private insurance or Medicare or Medicaid, they should treat that information just like they do any financial information, the way they treat their Social Security numbers. Never give out your Medicare number, never give out your private insurance card number to anybody over the phone. Never give that information away, and always secure that information just like you would any very critical information.
But all your stuff's about to go online. How are you supposed to prevent people from tapping into it?
Well, if you go any website, you should never go on a website and exchange information about medical information unless you know
that. But the doctors are going to do it. Like, pursuant to the new policies, the doctors are now going to take all of our medical information and put it online. We don't have anything to say about it.
Well, I think what's going to happen there is that before doctors and physicians and other healthcare providers can do that, they have to make sure that those systems that they're using meet the specifications and meet the security requirements that are in place.
Yeah.
And if they do that should help with the issue, but obviously it's not going to prevent every type of misuse of that information.
And we're trying to get answers on whether they're even trying to do that. We had a woman on Friday who has started an online petition to try to insist on that kind of thing. So far, we haven't heard of anything. We haven't heard of that sort of security blanket, but we're digging. We're digging. Louis, thanks so much for coming on.
Well, thank you very much.
And folks, if you missed any part of that interview, we will be posting it for you on our show page. You go to foxnews.com/America Live, and you can see also the interview we did on Friday on this same subject. We're going to stay on this for the next week or so because medical record privacy is something we've gotten so many emails about. A lot of you are very, very concerned. And we're trying to find out just exactly how worried, if at all, you need to be. Are you actually more protected now than you used to be? Another question we'll be examining later this